Hi, everyone. Thanks very much, Annika. Like she said, I'm Rayna Patel. I'm CEO and co-founder of VineHealth. VineHealth was really formed to support people living through cancer to optimally self-manage from home and help them understand how to best understand their medications, seek help at the right time, report their adverse events, and interact with care in the most efficient way possible, as well as to get the best outcomes possible for that patient. Next slide, please. So I'm sure the background to this will be familiar to many of you, but there's very strong research to say that actually patient self-management is currently done very poorly, and that has a real adverse effect on outcomes. So, deteriorations are often detected late, as was mentioned earlier. That results in many emergency department admissions, which are not only expensive, but lead to a cycle of poor care for many patients. And on the patient side, we know that patients don't feel confident in managing their care from home, which again leads to much worse outcomes. And actually, there's a few very well-known papers in this space, one by Ethan Bash, which I've quoted here, which showed that if you can monitor these patients effectively and longitudinally to understand who's deteriorating when, you can actually feed that into much better clinical decision-making, as well as much better supported self-management, with a real tangible increase in survival. So in this study, that was 20% or 5 months increased survival over 2 years. And that's been replicated in a number of papers now to show that there's a really measurable survival effect from, firstly, measuring that patient-reported outcome data or PROMS data, and secondly, feeding it back into care. Next slide, please. So the VineHealth platform supports that self-management. We do that through a patient-facing mobile app that supports the patient experience, helps them to understand their symptoms, track their medications, loop in caregivers, know when their appointments are, understand what information to read, how to report adverse events, how to come to a consultation with the right information, and kind of have a history nicely summarized. And what we know is that all of that reduces overall burden on clinicians and reduces overall healthcare utilization, particularly things like ED attendances that often aren't producing great outcomes for cancer patients. And what we've found is that because patients are engaging so well with the support offered within the platform, that actually we can layer on top of that really rich data collection, be that toxicity assessments, validated PROMS measures, red flag questionnaires, chemo assessments, or kind of prehab information. And all of that is really well engaged with, so that we can generate really consistent patient-reported outcome data sets for trusts to be able to optimize their service, to receive various tariffs and meet targets, as well as to make day-to-day better clinical decision-making based on how patients are doing and where resources best directed. For example, in triaging patients remotely more effectively and understanding when they're deteriorating and when they might be too toxic for treatment. We've had brilliant support from the NHS. So we are one of 12 technologies supported by NHS England as part of their National Innovation Accelerator, which means NHS England is supporting us to scale across the entire NHS over the next 3 years, as well as having been funded by NHSX and having relationships with every single AHSN in the country. Next slide, please. And again, we've been supported on that by many of the key opinion leaders in this space. So, many of the oncologists across the NHS, there's just a few pictured here, but we have probably nearing 50 in our kind of network who have actively helped us build this platform, collaborating on how features are designed, what the dashboard looks like, how we make this actually firstly useful in day-to-day practice, and secondly usable in the time and resource that clinicians have, so able to be presenting information that is processable in the sort of 5 seconds that you have before a clinic, or in the short time that you're able to spend triaging patients in a telephone consultation. Next slide, please. And then just to cover some of the kind of regulatory and data governance approvals that we've had. So we are not just an app, we are a class 1 CE marked medical device. We are GDPR compliant. We're FHIR and HL7 compatible, which means we can interoperate with electronic health systems. And so all of the data that we're collecting from patients can be transferred to clinicians for them to be able to see that in real time, to be able to inform their clinical decision-making, compliant with NHS DSPT, Cyber Essentials, and various other regulatory requirements. And really importantly, we've built our patient-facing platform so that it's really usable by the actual population of patients who have cancer. So, often over 65, and often not your typical technology user. However, although there are sometimes doubts about whether patients of that demographic will use this kind of technology, we've actually shown that they really will very effectively. So our most active users are the over 65s. We have about 7% over 80s using the platform. And actually we have many over 90s using the platform because it allows them to loop in caregivers and loved ones to their care and helps them manage more effectively in collaboration with those caregivers. The app will read out loud to you. It will coach you through how to press certain things. It will support you if you've forgotten your medications. It will help you communicate with your care team. It really is suitable for people who are sight impaired or colorblind. You can use the font in any size. And so that accessibility has really been a focus of ours. And that's why we are rated 93% by Orca, which is the highest rated cancer tool on the platform. And that really relates not just to our data governance and regulatory approvals, which are kind of covered over and above the extent to which they need to be, but also the patient feedback that we have. And that really has a massive effect in terms of the engagement that we have from patients and the data that we can therefore collect from them and feed into clinical practice. Next slide, please. So just to come here onto a few slides explaining in a little bit more detail what the platform looks like and how it can support. So on the patient-facing side, we have this mobile app. A key part of that is enabling patients to track their symptoms, side effects, more lifestyle-related factors like well-being and mood and activity. Importantly, all of that is done along clinically validated scales. So we use CTCAE toxicity scoring to allow patients to track their symptoms. Patients really enjoy that, seeing the trends in their symptoms and understanding when they're deteriorating and being able to share that with their loved ones. But it also means that that information can be conveyed back to their clinicians to understand who's at risk of deteriorating and where those deteriorations are happening and direct their resource more effectively. We can also deliver activity data to inform performance status assessments. We can deliver an intelligent chatbot that conveys the answers that CNSs would often be kind of bombarded with phone calls about, that are often quite template and can be transferred into the platform to reduce that burden upon CNSs from call lines so that they're focused on the most pressing issues clinically. And we can also build into this really service-specific alerts to patients to understand how they should be managing certain symptoms and adverse events. So for example, if you want any patient in your colorectal cohort to be prompted to call a certain hotline if they track, let's say, a temperature over 38 degrees, or if they track diarrhea more than 4 times a day, all of that information and messaging can be built into the system so that patients feel really confident in how to manage their care, when they should be presenting, what should prompt that, and how to present. And we know that that makes a real difference in how they do that, both from a quality of life perspective and their own confidence, but also in relieving the burden on healthcare services. Next slide, please. And then a large part of what we do is medications management. So we're actually in use by many specialist pharmacists as part of onboarding patients onto SACT treatments. We've programmed in every possible iteration of how cancer care can be delivered into the platform. So cycles, radiotherapy, on days, off days, PRN medications, all of that is really easy to plug into the platform. Often we find that specialist pharmacists are now doing that in collaboration with patients when they get onboarded onto treatment. Previously, they were finding that they would deliver a whole load of information in those sessions, and then patients were going home and getting confused about their medications, and that was having a real knock-on effect on service burden as well as patient outcomes. So with this system, patients receive smart reminders, their caregivers can too, and we know that that significantly improves medication adherence as well as significantly reduces the follow-up needed by specialist pharmacists. Next slide, please. And then finally, on the patient-facing side, we can program in any kind of information that you might want your patients to receive. As standard, we have a really extensive library of information that is taken from our very trusted charity partners who already deliver information via the NHS. So importantly, we don't write any of this ourselves. It's all from information that's already been being deployed in the NHS. And it's all broken down into bite-sized chunks, so 1 or 2 minute reads, that is through our machine learning algorithms delivered to patients as and when it would actually be beneficial to them. So for example, if we have a patient who is on steroids and we know through their smartphone they're struggling to sleep, the app would automatically serve to them the information on how best to sleep when you're on steroids. Or if it's clear that they have been logging anxiety or that their heart rate variability has been going up, it will direct them to psychological support and breathing exercises and mindfulness and meditation. And we know that that personalized approach is really valued by patients. It makes it feel that they have a really personalized companion that understands what they're going through, understands what drugs they're on, what disease they have, where they are in their treatment journey, and what they've been reporting recently. And on that basis, serves them the information that is most relevant without them having to read through a massive booklet that we know gets left on shelves, or having to trawl Google, which can really upset people and be quite traumatic to go through. And as well as the default information that we have in the platform, we can also program into this service and trust specific information. So if you have a prehab program that has lymphatic drainage videos for breast cancer patients, or physical rehabilitation kind of schedules that you want delivered to certain patients on a certain frequency, all of that can be programmed into here to really support exactly the messaging and the self-management that you want your patients to do. And again, because it's packaged into this whole support system, we know patients really engage with it, and that has a real knock-on effect on relieving the burden on clinicians to deliver that in a much more manual way. Next slide, please. And then here's what the clinician-facing part of the platform looks like. So all of the PROMs and symptom and toxicity, adverse event, medication adherence data that patients are logging in our patient-facing app can be transferred through to clinicians via this dashboard, which can be accessed from any NHS computer. So this dashboard can be customized and set up as you want. We often find CNS is using it to triage their patients ahead of telephone consultations, or to understand who's deteriorated or has an adverse event or needs to be brought in urgently. We find that oncologists are finding this really useful to have a neatly summarized history based upon CTCAE toxicity scoring at the start of their consultation. And there's very clear evidence that having that both improves patient and clinician satisfaction with the outcome of the appointment, because you're not relying on a patient who might feel vulnerable or stressed coming into that appointment to remember and summarize everything that's happened to them. It's already there, but also it shortens the length of the consultation in general, because that information is there ready to be viewed in a nice, succinctly summarized way. And therefore you can focus your time on what is the management plan and how can we encourage patients to buy into and follow that management plan and really understand it. So we know that that benefits patients and clinicians, as well as saving resource. Through this dashboard, you can decide how you want patients to be alerted or nudged. So is it that you want them to be prompted to fill in a certain PROM at a certain frequency, particularly if a patient is discharged from acute care and they are in kind of any kind of long-term or stratified follow-up? Are there certain red flag questionnaires that you want to be delivering to understand who's at risk of deterioration? You can decide on the alerts that you want to be specified. So it might be that if a colorectal patient is feeling much more fatigued on a certain basis, or has lost a certain percentage of weight over a certain period of time, you want them to be prompted to get back in touch with their CNS. And all of those alerts can be tied to patient tracking, and you can prompt that patient tracking exactly as you wish. So it's really customized to set up in collaboration with how your service works. We can you can prompt the dashboard to deliver H&As or pre-chemo checklists or toxicity assessments. So really this can be set up in exactly the way that supports your service. Next slide, please. And then just finally here, this is some of what patients and clinicians have said about the platform. And the real core message that we get back is how easy this is to use. And I think that's worth overstating, because it's often what is the barrier to patients engaging with these kind of tools, is that they're not built for 80-year-olds. They're not built for their caregivers. They're not built for people who haven't used an app before. And that's what we focused on. And that's why we have such brilliant engagement. Our colleague from the National Hospital from Neurology will be speaking shortly, but one example of that is a study that we recently did with the Royal Marsden that showed for patients aged 22 to 77, 97% engagement. So on 97% of the occasions that we asked them to fill in a questionnaire or engage with the app in a particular way, they did so, and that translated to 100% PROMS completion, as compared to 40 or 50% as the prior standard, as well as a 52% increase in medication adherence. So a really tangible difference in how patients are self-managing, as well as in independent interviews done by the Royal Marsden. 87% of patients saying that using this significantly improved their quality of life. So we know that patients like using it, that they use it effectively, and that effective use translates into better self-management and better interactions with care. So to talk about that deployment or kind of similar deployment in more detail, we have my colleague Felix Josza, who will talk about a study that we recently did with the National Hospital for Neurology. So over to you, Felix.
Thanks, Rayna. Hi, good morning. Could we go to the next slide, please? So yeah, I'm just here to talk about the study we did at the National Hospital for Neurology and Neurosurgery in the neuro-oncology service to look at the feasibility and the safety of using VineHealth in our service in the post-operative period after the surgical admission for these brain tumor patients. So we designed an ideal stage 1 study using the framework for surgical innovation outlined by the ideal kind of framework. It's a stage 1 study, so low digit participant numbers to establish sort of proof of concept and feasibility. We used the app to collect a wide variety of quantitative and qualitative scores and data from patients, as Rayna has outlined, using the VineHealth app. And then after the study, we undertook some interviews with patients to gain feedback from them how they felt using the app during this period. Next slide, please. So our outcomes were principally three kind of principal outcomes. We wanted to see how patients could engage with the app in the post-operative period, and it's not clear that would be easy for these patients having undergone a large, brain tumor surgery, a big physiological hit. Often they're undergoing radio and chemotherapy, and so we know that all these things have an effect on fatigue and how patients are feeling. So we wanted to see if really engaging with an app on a daily basis is something that these patients would feel up to, and whether or not that would improve patients' subjective kind of feelings about their care in this period, and then feedback from them. So we recruited 6 patients between the age of 45 and 69, just before their surgery on admission. 3 of these patients had glioblastoma, 2 had a cerebral metastasis from peripheral tumors, and 1 had a hemangioblastoma. They all had craniotomies, and the 3 GBM patients had adjuvant chemoradiotherapy. Next slide, please. This is just some more screenshots of how the patients see the app, showing sort of the dashboard, reminders about medications and the calendar, Likert scales about symptoms, mood related to anxiety and stress, and more general symptom reporting. Next slide, please. So we found over the 12-week period of the study really high, actually really high engagement between patients and the app. There were 100% completion rate of these surveys, which are native to the app, and lots of well-being score reporting from patients. Participants felt that the kind of monitoring of their symptoms through these surveys were really helpful to them in monitoring their own well-being. And feeding that back to the healthcare team, and likewise with the medication reminders. About 2/3 found they engaged with the articles in the app about their diagnosis and treatment they were receiving. The appointment tracking function wasn't used, and the feedback after the study found that kind of 3 key areas were identified by the patients as how they felt benefit from the app. Firstly, around nutrition and lifestyle. So for example, all of our brain tumor patients go home on dexamethasone, and the effect that has on weight and sleep. Information about that and how to kind of manage that and be prepared for that was really useful for them. Secondly, sort of tracking vital signs and activity in the app through integration with wearable devices was useful, so heart rate variability and things like that. Finally, patients found tracking of symptoms and their general mood and well-being really useful, given that a large number have kind of perioperative stress and anxiety, understandably, after what they're kind of going through. So kind of all the patients felt that the use of the app really did improve care for them in this post-operative period. Next slide, please. So we found kind of at the end of this kind of small proof of concept study that VineHealth really is has a large potential to collect a lot of data about how patients are doing in this critical period after the surgical admission when they're at home, and this is really important because, you know, we want to know how these patients are doing given the various risks of, you know, post-operative infection and delirium and side effects from treatment, etc. And so having a better snapshot and a two-way conversation at home with these patients is really useful. And furthermore, patients felt a real benefit from this interacting with the app. So we think this could really improve sort of clinical and holistic care of the patients in this post-operative period. We're excited to kind of conduct further larger studies building on this kind of proof of concept study in the neuro-oncology service to see how far these benefits can go. Next slide, please. And just as a short illustration of that, a couple of examples I've put here. So it's a case we had a few months ago of a 28-year-old lady who had a right frontal craniotomy and was undergoing adjuvant chemoradiotherapy, and she presented out of hours at a weekend to her local A&E 2 weeks post-op with a possible wound leak. She was assessed at and imaged at the local A&E and then sent over as an emergency out of hours to our unit. And on arrival, she had a simple revision of the wound on the ward, didn't require surgical revision. But unfortunately, she developed delirium as part of this hospital admission. And given the kind of the costs associated with the out of hours A&E assessment, transport, hospital admission and ward bed, kind of hypothesizing that the use of the VineHealth app in this scenario may identify these problems earlier through kind of vital sign tracking, tachycardia, low-grade fever, well-being scores, general kind of increase in fatigue and concerns about the wound, possible you know, photos uploaded to the app, which can be reviewed by the team. And so could we identify this problem earlier before it gets to the point where the patient feels they have to present out of hours to A&E, but instead identify it earlier, bring the patient in for an expedited follow-up clinic appointment and manage this problem in an elective fashion as an ambulatory outpatient way, which would be better for the patient and reduce those costs for the system. And the flip side of that coin is, you know, a similar patient who's undergone similar sort of surgery, if they're actually at home doing very well with no reported issues, vital signs are normal, no issues with side effects of medication or with their mood, could actually the VineHealth app triage this patient to, you know, to have a virtual follow-up clinic rather than a face-to-face one, improving, you know, potentially the cost and time of the patient coming into our unit from, you know, perhaps far away in the outer reaches of the catchment area that we serve, and also improving sort of general patient flow in the hospital and the service and the costs associated with that. So we're keen to see in further studies how this can kind of benefit further these patients in this group. Thank you very much. Next slide, please. I'll hand you back to Rayna.
Thanks very much, Felix. Yeah, so just a couple of points to tie up there after a nice illustration of how we think this can really support clinical services. And more widely, what we know is that there is a real difficulty in trusts enacting some of these priorities of the long-term plan in terms of delivering personalised care to every cancer patient by 2021 was the original plan, but obviously that has been pushed out. And really what we enable trust to do is have that personalised support and care delivery to every patient, as well as supporting self-management, doing that through digital technology, and using that to support clinical care in terms of a common source of truth and bringing the patient voice into that shared clinical decision-making as well. Next slide, please. So that's that all from Felix and I. Thank you very much. And if there are any questions, happy to answer those either now or at the end. I can't see any at the moment. So thanks everyone very much.